Morning!
Today is the day. Today is Monday, December 31st, and it's really early. It's 4:06 right now, and we are headed to the hospital. I'm not ready. This is gonna be a short video, because I'm not gonna be able to record a lot of stuff.
But I can.
We'll see how it goes. We're here. I got here faster than I probably would have liked to. I'm nervous. This place is big. I feel like we're at a fancy hotel.
Very nice.
I think there is a Christmas tree in the door. So cool.
Sitting outside.
Good morning. Do you have to go through this door? Oh, you do. There's 4 Christmas trees in this store. Seriously, a lot of decorations at Starbucks. I think we're the only people here. There's so many decorations. What is the doctor doing tonight for New Year's Eve? What's his plans for tonight? I'm tired. A lot of people have told me that being under general anesthesia is the best sleep that they have ever had.
I'm there with you.
I hope so, because I didn't sleep a lot last night. That one is me.
Found an art gallery. They have little things like these set up all over the hospital.
They're in surgery. You can't open your eyes. That was a long time. You just seen them again. Because you started so early, you have all day to decide, I guess, how you're doing.
I can't keep my eyes open at all for hours now. You would have thought that this would have worn off by now. I guess everything is planned. My foot would be completely numb. They did some sort of like a numbing.
They called it a nerve block.
A nerve block. So I can't feel things. I don't know. We're currently just waiting for someone to come here to deal with my knee brace situation because it was really difficult to pee. There were 2 nurses in here and my mom, and it was a nightmare, and I can't imagine having to do that at home. So I'm supposed to be keeping my leg straight for a while now. Like it seems like for most of the time that I'm going to be on crutches, it's going to be straight. So we have to get this situated because that thing goes all the way up to my crotch and all the way down to my ankle, and it just can't be right. So we're waiting for someone to get here. This hospital is so nice. It's so quiet right now, but Chris says that's because we're the only people in here. I guess no one wants to have surgery on New Year's Eve. I just keep falling asleep.
The pain pills.
The worst part was getting the IV, I guess, because that was the only part I was awake for. And it's still in there, but it's just not connected to anything, so it's driving me bananas. I just want to take it out. I guess we'll find out what we're gonna do with the knee brace and then leave and eat food.
First floor, please.
Somehow we got you in there. I do not know. That was not easy.
Hello! It has now been 2 weeks since my surgery, and I wanted to do a little update and a little video to go along with the footage that we have from that day, because I wasn't the one taking the footage. So I had knee surgery on Monday, December 31st, so on New Year's Eve, and I was told to call the hospital the Friday before and find out what time you were supposed to report to the hospital for your surgery. They told me that I needed to be there at 4:45 in the morning on New Year's Eve, and then they also told me that I really needed to hydrate the day before. So on the Sunday before the surgery, I was drinking so much water, and I never really got that nervous or that anxious for the surgery. I expected to be experiencing a lot of anxiety pains, a lot of like nervous stomach, but I never really got that at all leading up to the surgery. I really expected to, but I didn't. So I drank so much water on Sunday, I could not stop using the bathroom, and then we had to get up super early the next morning to go to the hospital. So that really stunk because I definitely didn't get a good night's sleep the night before, but I guess it didn't really matter because it's not like I was the one performing surgery. I had my surgery at Capitol Health in Pennington, New Jersey, and it's a beautiful building. The building just looked like a hotel. It was so beautiful, and there were so many deer on the side of the road like as we were coming into the parking lot, so that was a little freaky. When we walked in, it just looked like we were about to be staying over in a hotel. We had to go upstairs to, I guess, the floor that they have the surgeries on. We went to the waiting room that my parents and Chris would be waiting in while I had my surgery, and then I got checked in, and then I was brought into a room to, like, I guess get prepped for the surgery. So they had me pee into a cup so they could do a pregnancy test just to be sure, and then I had to get changed, so I couldn't wear anything, nothing, no undergarments or anything. They had told me on the phone the Friday before not to wear any jewelry. I made sure to leave that at home. I don't have my ears pierced, but they said to like make sure you don't have any jewelry. I did have a hair tie on my wrist, and no one ever said anything about that. I had my hair down, and I guess I know for the future that I would probably like to have my hair pulled up. I didn't think about it until it was too late though. So they had me get changed into a paper hospital gown and disposable underwear, and at first I was really freaking out about the underwear. I was like, oh my god, I'm gonna be so uncomfortable in this, and I'm gonna be stuck in these for a while because I know I'm not gonna be able to move very much after the surgery, so this is gonna be terrible. But they actually ended up being great, and I was so happy that I was wearing them because they were so stretchy and they could stretch over my brace when I needed it to. The dress that they had given me, well, the gown, the paper dress that I was wearing, it tied in the back, and it had a couple different layers to it, and it had these like weird places for holes. After I got changed and the nurses came back in, there were so many nurses, by the way, that were dealing with me, and they were all very nice. They were so friendly. They were very just like calm, and I respond well to that. I always have problems in doctors' offices. I never do well. I'm always very nervous, but they all made me feel really good. So the woman who set me up with all of this stuff to get changed into, she came back in and she hooked up a hose to my dress into the hole and said that it was like my own air conditioning and heating unit, basically. So I could control the temperature of my dress That was amazing. I need that for home. So that was so cool beforehand because I was sweating so much. I am definitely a sweaty person. I sweat when I'm nervous, and I wasn't feeling nervous. I wasn't feeling like sick or anything, but I was definitely sweating. I could feel the sweat pouring down my sides from my armpits. Like, I was sweating so much. Like, I was expressing that I was really nervous, and they let me turn the air conditioning on in my dress, and it was so awesome. So when I was in there, they were like just going through things, asking me questions. After I got the dress on, I was hooked up to the IV, which was the part that I was the most scared about. I was the most nervous about having a needle in my arm from the second that I found out that I was gonna have surgery. I wasn't as nervous about the surgery part as the needle. I'm not a needle person. I like that, it just makes me queasy just to think about it. I told the nurse that I was nervous. I had never had surgery before. I had never been put under general anesthesia. The general anesthesia and the needle for the IV were the two biggest things that I was the most nervous about. And she was very nice, and she said that she was going to use a little needle, and she was very nice, and she was very good at giving me the IV, so I've heard, because she did it very quick. I am right-handed, so she tried to do it in my left arm first. There were no veins available for her, I guess, so she had to do it in my right arm, and that was the part that I hated the most. It definitely did not feel good, and after I had the IV in my arm, I did think to myself, like, oh, I should have put my hair in a ponytail at this point, but I can't now because I was so afraid to move my arm with the needle. I was very uncomfortable with that in my arm, so I didn't want to move to like pull my hair back, but I think that I probably should have had my hair back. I'm surprised they didn't tell me to put my hair back. But my family was allowed to come into that room after I had the IV. I don't think that there was any footage from that. Like, we didn't know what to expect. So I'm sure the next time that I have this done, we'll have footage from that moment. But then the doctor came into the room, and we actually had the doctor re-explain what my surgery was, because the day that I found out that I was having surgery, it was all kind of a shock, and I didn't really retain the information of what the surgery was actually going to be. So he explained the entire thing to everyone again. And then the anesthesiologist came in and started asking questions, and she asked me if I was interested in a nerve block, and I didn't really know what that was going to be like, but I didn't understand why you wouldn't do it at the time. So what she explained was that right before the surgery, she was going to use an ultrasound machine on my leg to find the nerves, and then use something in a needle to numb like those nerves, to basically numb my entire leg. So when she was explaining it, I was already so freaked out. I agreed to do it because I figured, why would you want to feel what's about to happen? And it was all very quick. Then my family left, and they wheeled me into the operating room, and then everything starts to get fuzzy. They put like an oxygen tube in my nose, and like the whole time I'm asking, like, what's an IV do? What's this thing in my nose do? That's when I felt someone start to put a hairnet on my hair, and I was like thinking, oh my god, I should have put my hair in a ponytail. So I've learned for next time I'll just put my hair in a ponytail. I felt them put that gel on my leg for the ultrasound, but then I was out. They put a mask on my face, and apparently at some point a tube was then inserted into my throat, but I never realized that it was there. I was not awake for any portion of that. It went in and came out before I was awake, so that was good, because I did some research on general anesthesia before the surgery, and I had read that that was something that could happen, and that made me nervous thinking about a tube being put down my throat. I know that I would not be so graciously accepting of a tube being put down my throat if I was conscious. So I'm glad that it happened and the whole thing was done before I even woke up. So my surgery was scheduled to take 2 hours, and during that time my parents and Chris were in the waiting room. There was a TV out there that said like the progress of all of the surgeries that were happening, so they gave me like my patient number, I guess, and my parents and Chris were able to like track that on the TV. And we ended up being in the hospital for a really long time. I don't think we ended up leaving the hospital until 12 hours later after we got there, but I think they were in the waiting room for like 6 hours or something. It was long. The surgery that I had was very intense. It was not a knee replacement. It was a whole bunch of other stuff. It was basically a knee reconstruction. So I have the actual terms of it here. I didn't have this written down when I made my first video, the I'm having surgery video. So it was, I guess, a 4-part surgery that I had. The first, and now 2 weeks later, probably the most painful part of it all, was a tibia tubercle osteotomy. I'll like put that down here. That's basically meaning that my leg is broken. The lower part of my leg, the tibia right underneath of my knee, was fractured and moved. The alignment of my knees has just been incorrect for my entire life, so that is supposed to fix that to be able to keep my kneecap in the correct place. There were also apparently screws in my leg that I didn't know that were going to be there until the day of the surgery. So that has been a very painful part of this recovery, is that I have a broken leg now. The second part is MPFL with allograft. So what that stands for is Medial Patellofemoral Ligament Reconstruction. Lateral lengthening, and OCA, which stands for I just want to see a video so I can learn how to pronounce these words, and now I'm looking at really gross images. So OCA stands for Osteochondral Allograft Transplantation. That's the cartilage. I'm gonna stop Googling the things. So it was an intense surgery, a lot going on, a lot of medical stuff that I really don't understand. So many different things are happening in my knee during the surgery. I guess it was a long process, but apparently everything went well, so that's great news. And after the surgery was over and I start to like wake up, I was shivering so much. Apparently that is just from the anesthesia. That's like a side effect that may happen. So then they turned the heater on in my dress. That was amazing. That was so cool because I really was like uncontrollably shivering. And then I got really sick. I said to whatever nurse was standing right there, like, oh, I'm gonna be sick, and she was so quick with the little bowl, and I did throw up a couple times and then I fell asleep. So it was a really long time before my parents and Chris were able to see me after the surgery, because the nurses let me sleep after I had thrown up. They apparently went out to the waiting room and told my family that I was sick, but apparently I was asleep for a long time after that. Eventually, I don't know at what point this happened, they changed me out of my paper dress into like a regular like cloth dress. Like I just remember like people, like there were so many people around me like changing me, and like there were people that I didn't recognize from before the surgery, and it's just like a silly thing. Like when you're having surgery, you kind of have to just like forget about your modesty. Like I do not like to be revealing in any sort of a way, and now there's all these people like changing my clothes for me, and it was just silly because they're like, oh, by the way, my name is, I'm just like, oh my heck, well, all right. I got wheeled into the room that I was in before the surgery, and they brought me graham crackers and saltine crackers, and they asked me what kind of juice I wanted. They had so many different choices. I was super excited to choose apple juice and eat something because I had to stop eating and drinking at midnight the night before the surgery. So it really wasn't that much time from midnight until we had to be at the hospital at 4:45. It wasn't like I had to wait a whole day without eating. It's cool to have like a little cracker snack after throwing up. When I threw up, it was only stomach acid. This is gross. I'm gonna have to put a disclaimer before this video. There wasn't anything in my stomach to come up. When they brought me into the room, I couldn't really feel anything. They were asking me what my pain levels were. I feel like I was underestimating the amount of pain that I was in. I wasn't conscious enough to make a good guess about what kind of pain I was in. My knee was totally wrapped up. I later found out that there was like a huge layer of like cotton, and then 2 ace bandages, and then my knee brace, which is gigantic. Then they had like a big huge ice pack wrapped around that, which was super silly because there was no way that that coolness was reaching my knee at all. It 100% was not, but whatever. The doctor came in and told me that everything went great, and that based off of the way that things went, he thought that I would be able to go home that same day, which was up in the air before the surgery. It was just going to depend on how everything went. I don't really remember seeing him though. I was like still pretty loopy at that point, but after he left, then my parents and Chris came in, and it was just a while. It was a long time of being in that room. I couldn't stay awake. I was super out of it. I had no idea what kind of pain I was in yet. My leg was really numb from that nerve block. got, and I don't know if I would get it again. My entire foot was numb, and that made things pretty difficult. Eventually, after being there for a couple hours, I did have to pee, and I'm wearing my knee brace in the state that it was. It was like the exact same knee brace that I had before the surgery that I had been having so much trouble with because I can't pee when wearing it. So I needed a lot of help. So we had the physician's assistant and like an aide and my mom and me, and it was just a very difficult experience. I needed all of those people to help me get onto the toilet because the brace would have been soaked if I didn't have those people helping me. It was just a nightmare. So at that point, someone made a call to get the person that like sells these braces to come to the hospital to like fix it for me to make it like fit my body more. So then we had to wait for that. Eventually a guy did come. He broke off a little section on the inside of my leg and then cut a lot of the extra foam out of there, so it fits a lot more comfortably now, and I am able to use the restroom while wearing it because before it was just going to be impossible. Then I felt like it was time to leave. I don't know, I just wanted to go home. It had been a long day, but I really couldn't feel my leg at all. I didn't know what kind of pain I was in. They had moved me into like a reclining chair after I had used the restroom, and I was able to change into the clothes that I had brought with me. Luckily I had like a night dress sort of thing to wear because there was no way I was going to be able to get pants on, and they had someone come with a wheelchair to like bring me outside, and that was probably the worst experience about the whole time in the hospital. Like everyone was really so wonderful, all of the nurses were great, the doctors great, the building was great, everything's clean and nice, but like the dude that was pushing me in the wheelchair was like straight up running. I don't even know how to explain how ridiculous this situation was. I think like we were all in shock about how it was happening. So like I get into the wheelchair and then he like takes off and my leg like flies off of the thing that was like holding it up. It was just crazy. Like after that I was like really ready to get home. Getting into the vehicle afterwards was also quite a struggle. It was just very difficult to do things because my foot was completely numb. Like I couldn't feel that I was not putting any pressure on it or putting, like, it was very hard with that nerve block because I couldn't tell what was happening after the surgery, and I don't know if I would get it again. I don't know how much worse the pain would be without the nerve block. I don't know. My foot was numb for a couple days afterward. Once I was at home, we had the prescription for painkillers and I had to start taking aspirin to prevent blood clotting. I was just feeling sick for like the first week. I was just feeling super dizzy from the narcotics, really nauseous all the time. I didn't feel like any of the pain medications were helping the pain, and they were just making me feel sick. So that was hard. That first week made me really think about having to have this surgery done again. I am gonna have the exact same thing done to my left knee in the future when I choose to do it, I guess. For the surgery, I thought, oh, well, I'll just get it all done. I'll wait until this one is recovered. I'll wait until I'm like good to go, and then I'll get the left knee done right away. That's not the case anymore. That first week was so terrible. I can't even explain it. Because I was having such a hard time with the pain medication, I was going periods of time without any, and I've never felt anything like that before. My whole body was just tense because of how much pain was happening. And eventually I stopped taking the narcotics and just switched to extra strength Tylenol, and we got a different type of aspirin, and it made all the difference. I am not feeling sick anymore. I did get sick from the medication, and that it was just terrible. You don't want to be experiencing that on top of the pain. It was just a week of sleeping. I couldn't stay awake, and when I was awake I felt like death. That was very tough. The first week was tough. It was way worse than I had ever expected. I don't think I really thought about the pain that much because I've been in a lot of knee pain for my entire life. I didn't expect that it could be worse than what I have already experienced in my life. I was super wrong, like so wrong. I've never experienced pain like this before. But by the time that I had stopped taking the narcotics, I was definitely feeling a lot more like myself. Doing anything has been a struggle. The extra strength Tylenol doesn't help that much with the pain. It only helps for a short period of time, and like when I take it and know, okay, I have to use the bathroom during this time. I have to make the use of this Tylenol worth it as soon as I take it, because you can only take it every 6 hours and it only lasts for about an hour maybe. And I would just be exhausted. I would like go to the bathroom and then have to take a nap, because just moving, just going down the hall would just be so exhausting. So it's been an experience. I've never had to do anything like this before. It drives me crazy to have help. I mean, I have plenty of help. My parents are taking good care of me, and Chris ended up staying with me for the first week, which was very nice because just getting in and out of bed was impossible on my own. During that first week, my foot was completely swollen. That was so bizarre. So eventually the numbness from the nerve block went away. It took a couple days for that to go away, so I eventually could start to feel my foot again, but then it was so huge. It like barely fit in a sock. So now that this is the end of the second week, it's just been difficult in a different way. It's definitely less painful, but still very painful, and still the Tylenol is not helping very much, so I'm taking it when I know that it's gonna be worth it. If I'm gonna be trying to bathe myself, I'm gonna have to take the Tylenol immediately before I do it. So on Friday of the first week, my grandmom came over to unveil this knee. She came to help unwrap it. I had to keep it all wrapped up. We weren't able to see the incision or anything for pretty much that whole first week. So there was just layers of that like cotton on top of the knee with ace bandages wrapped around it, and then my knee brace. I was super afraid to look at my knee. I am very squeamish. I didn't even know how squeamish I was until it was like gonna be time to unwrap my knee, and I didn't realize how badly I did not want to see it. That surprised me. It was stitched closed on the inside and then glued together on the outside. Then it was like taped all on top of that. I was instructed to start getting it wet at that point, and then like the tape would eventually come off on its own. It's still not completely off, like a week after that. The weeks are going by very slow, so now I'm at the end of like the second week. It's just been difficult in a different way. I feel more like myself, so I want to be able to do things. I want to get out of my house, but I can't. I cannot get comfortable enough to go to sleep at night, so my sleeping is just terrible. My leg is in constant pain, which really sucks. I really wish that the pain medications helped more than they do. Ice has been a key. Now that my leg is not wrapped up anymore, I can use the ice and actually feel it. I'm just pretty much icing it all the time because that's the only like little bit of relief that I have. My parents actually made some bags full of frozen peas, which have been the best so far. Right now, as I'm sitting here, I have this kind of ice pack on my knee, and these things thaw out in like 10 minutes. It's ridiculous, and since I can't move and I don't want to keep asking people to get me new ice, these are irritating. The peas stay frozen for hours. It's awesome. I started physical therapy on Tuesday, so 1 week and 1 day after my surgery, which was a lot sooner than I had expected to, but that was awesome because not that much time had passed, so that was good because I know from experience that the longer you go without moving, the worse it's gonna be. I'm really liking my physical therapy now. I am going to a different place for physical therapy after a really great recommendation, and I'm really enjoying it. I feel like I'm not in as much pain as I could be when I'm at physical therapy. I definitely take the pain medication right before I go to physical therapy, and then I'm like beat for the rest of the day afterwards. But right now I'm not really doing that much. It seems like it's small work that I'm doing at physical therapy, but we just have to get some movement back into my leg. I have to keep it straight all the time, but at physical therapy we're bending it and trying to get it to bend more and more and more, and it's tough. The skin is really tight because it's still very swollen, and the tape is making it a little tight, I think, too, and it's definitely not a comfortable feeling, but it's not extremely painful. I don't know if that's because I am taking the pain medication before the therapy. I'm sure that has something to do with it, but it feels good to have it bent. Keeping your leg straight all the time actually really hurts, so it's nice to go to physical therapy. I am now instructed to bend it on my own at home, like in a controlled environment. Like I'm not bending it while walking or anything. I'm walking with crutches. I'm not putting my full weight on my foot, and that is gonna be that way for quite a few weeks because we have to heal the broken leg, which stinks. I get really sharp pains in different places when I'm just laying in bed. It's just very uncomfortable, and I'm keeping it as cold as possible all the time. And that's why I'm filming this in bed, because there's no way that I'd be able to film this long of a video sitting in a chair or something. It's just been very uncomfortable. It's taking a lot longer than I expected for me to feel comfortable. I can't get out of bed for very long, and it's like, it's a little discouraging, but it hasn't been that long. I know that this is a very long recovery for the amount of work that was done in my knee. I'm just exhausted. I'm constantly tired because doing anything takes so much energy. Just to get out of bed takes so much energy. I'm so ready for it to be over. I'm ready for the recovery to be over already. I'm ready to just go back to normal because this is exhausting. I told my physical therapist I'm going to Disney in March. I only have so many weeks, and my goal is to just be able to walk in Disney. So that's where I'm at right now. So thank you for watching. Make sure to comment, like, and subscribe, and follow us on Twitter and Instagram. I will have some more updates as time goes on, and I think that I'll be waiting about a year until I get the next one done, because this has not been fun.